Hello guys, my name is Michael Bracchio. I'm one of the chiropractors at Velocity Sports Rehab. Today we're going to go over tendinopathy, which is just a big term used for tendon pain. So let's start with the more common term, which is tendinitis. Tendinitis used to be the term that we would use to describe tendon pain, and it was used because itis means inflammation, and so we thought that inflammation was the driver to tendon pain, right? Similar to if you sprain your ankle, you have inflammation in it, which causes the swelling, and that's typically painful. The problem is that when they did a little bit of research on painful tendons, they found that there was no inflammation present. That's problematic in looking at the treatment strategies, because if you think that inflammation is the driver to tendon pain, you're typically going to use anti-inflammatories, which would be like an NSAID, which is like an ibuprofen or a Tylenol, or corticosteroid injections. The problem being that if there's no inflammation, you're not exactly treating anything. And so more research was done, and they actually found that painful tendons, they were degenerated. And so this was termed tendinosis, which led to kind of a rethinking of how you would approach a tendinopathy, and you would actually try to regenerate the tendon. This led to some injections, which were called like platelet-rich plasma injections, which were used to kind of irritate the tendon and stimulate new growth. The more current thinking is that it's actually a continuum of tendinopathy, and so you go from kind of a normal tendon to a mild inflammatory reaction to all the way down to a degenerated tendon. And this was researched by Jill Cook. And so when you're looking at the Continuum Model now, there's 3 stages in it. There's a reactive tendinopathy, a tendon disrepair stage, and then a degenerated tendinopathy. And so because it's a continuum, there's overlap in between the stages. So it's not necessarily you're in this stage, or this stage. You can be kind of in between. And so when you're looking at a reactive tendinopathy, what's going on is that, like the title suggests, is that you're reacting to force typically, and you're typically looking at more like overuse. And so what the tendon does is it starts to increase cell production, which will increase the cross-sectional area of the tendon, which decreases the amount of force on the tendon per unit, right? Which is a great short-term strategy, because if you're trying to decrease overuse by spreading out the force, you're helping out the tendon. The problem is that it's not a great long-term strategy, just based on when you're looking at a long-term strategy, you actually want to make the tendon more strong and more dense instead of building out. Which kind of leads to that second stage, which is the tendon disrepair stage. And so prolonged overloading of the tendon causes more and more cells to be produced, which will increase the amount of fluid that's going to accumulate in the tendon. If you guys are familiar with like osmosis, right, the more cells you have in the area, water is going to be drawn towards the area with more cells. And so now you're having more fluid in the tendon, which is going to cause separation of the tendons and a little bit of disorganization in the collagen, which is problematic because now instead of a nice tightly knit tendon, now it's separated, so its ability to absorb force has been decreased. Then, the final stage, you're looking at a degenerated tendinopathy, which just means that there's extensive disorganization in the tendon. You've had a lot of fluid go in there. All the collagen is now not nicely oriented. It's kind of just separated everywhere. But now you also have cell death, which is obviously problematic, because instead of having nice healthy tendon, which can absorb a lot of force, now you have dead tendon, which won't. When you're looking at kind of which of them are reversible, right? If you're looking at a reactive tendinopathy, typically with rest, you're able to kind of reverse the changes, right? You decrease the cell growth, which decreases the amount of fluid, and then everything kind of goes back to normal. Once you kind of get down to the degenerated tendinopathy, it's typically not reversible. your goal in kind of like that end stage is to actually just try to regenerate or rebuild your tendons, which I'll talk about in just a little bit here. When you're looking at the stages of tendinopathy, pain isn't actually correlated to any one of the stages, meaning that a reactive tendinopathy isn't less painful than a degenerated tendinopathy. Pain is actually very poorly associated with the structural changes in the tendon. When you're looking at more of the new pain science research, you're looking at what is going to cause the most threat to your body, which is an interpretation by the brain. And so it doesn't always match what the actual tendon structure is. You could have a degenerated tendon with no pain just because it happened over such a long period of time, or you can have a degenerative tendinopathy which is very painful. One of the complications of this also is that you can have a degenerated tendon that is now producing more cells again, and going back into a reactive tendinopathy. So just because not all of the cells in a tendon necessarily have to be degenerated, so you could have some of the living cells reproducing, which kind of kicks off the cycle again. So you can have kind of a layering effect, which makes it pretty difficult to kind of stage where you are in that tendinopathy. Going into kind of treatment, so it's typically divided into kind of two stages. So the first stage would be like a reactive tendinopathy and early tendon disrepair stage. Just being that tendon disrepair is typically kind of like a transition from normal tendon to degenerated tendon. And so in that first stage, your goal is to limit cell proliferation, which is cell growth, or cell production, and collagen separation. And so your main treatment strategy here is load management. And so like I was talking before, you're typically looking at people who are overusing their tendon or overloading their tendon is probably a better way to put it. And so backing off of how much you're using that tendon, whether it be you're a runner and you're having Achilles tendinopathy, and so kind of decreasing your mileage, decreasing your frequency, decreasing your time running, are all kind of strategies like that. If you're looking at like a supraspinatus tendinopathy, which is on the top of the shoulder here, decreasing like overhead movements if you're a lifter, or decreasing, throwing. It's kind of important to note as well is that you don't have to stop completely. Tendons still need a little bit of force to kind of stimulate them, or else they kind of revert, right? If you don't have any force going into the tendon thinks it's not necessary, right? And so you'll start having cell death again because your body's not trying to waste resources on an area it's not going to use. During this stage as well, manual therapy, so either by hand or by tool. In the clinic we use Graston, can be used to decrease the pain during these stages. Those, like a manual therapy, stimulates mechanical receptors, which will help decrease the pain in a given area. It's also kind of important when you're kind of looking at an overall treatment strategy in this stage is to look at also the range of motion of the joints to make sure everything is working properly. If you have an area that's not moving very well, you're going to compensate and overload another tissue. So if you're looking at a runner and you don't have great toe extension, and so every time that you're trying to toe off, you're having to dorsiflex the ankle a little bit more, you could be overloading kind of that calf and that Achilles tendon. So you just got to make sure that you have adequate range of motion on all the other joints as well. Going into kind of like that second stage now, you're looking at a late tendon disrepair, a degenerative tendinopathy stage. And so at this point, you have extensive tendon disorganization, and then you also have that cell death, right? And so now your main goal is actually to increase cell production because you're trying to rebuild the tendon. And so the most effective strategy in this stage is actually exercise. If you've ever had like a tendinitis or a tendinopathy, you might have heard, or someone might have suggested you do eccentric exercises, right? Which is lengthening a muscle while contracting it. So if you're looking at, let's see here, what's a good example here? So if you're looking at like an Achilles tendinopathy, what they would do is you would stand on your tippy toes and then slowly lower your way down. So you're contracting your calf muscles while they're actually being stretched. That was all based off of Alfredson's research that showed that eccentric exercise was a great option to stimulate growth, tendon growth. More recent research has not validated that. So now you don't necessarily have to avoid avoid concentric, which is just contracting the muscle. So doing a combination is actually just as effective as just eccentric. That was based on research on the Achilles tendon. And so if you're just doing toe raises, right, or heel lifts, if you will, so if you're just lifting the heel and then slowly lowering your way down, you're still stimulating that tendon and kind of getting it to rebuild. When you're looking at kind of patellar tendon area, you could do the same thing, which would be by doing like squats, would be a good option. But they've also found that heavy, slow resistance is also a really good way to stimulate tendon growth, specifically in the patellar tendon. And so you would be looking at like a heavy squat where you could only do, somewhere between 6 to 8 reps, which would stimulate the tendon. When you're looking at kind of like that concentric, eccentric strategy, you typically have to do more reps, typically somewhere between 12 to 15, and do 3 sets. So it kind of depends on where the tendinopathy is, and kind of what your training strategy is to see if you have access to a gym, because if you're using like a heavy, slow resistance, you typically need weights, right? If you're doing it at home, you could typically kind of get away with, doing concentric, eccentric exercises just kind of at home. So I mean, those are typically your strategies. If you're looking at kind of like, if you're looking at like a tennis elbow, right, which is actually an extensor tendinopathy, the old treatment, for just eccentric was just isolating eccentric. So you would contract your extensors and then slowly lower the weight. You could just do wrist curls now, if you kind of use that same strategy to help stimulate that tendon growth. Kind of speaking on that, what I found really effective is actually doing grasping at the same time as doing like a concentric eccentric or a heavy slow resistance exercise, because now you're kind of stimulating the tendon in 2 different ways, which I found really beneficial in decreasing pain. One of the common questions that you kind of get when you're dealing with tendinopathies is whether to heat or ice. My opinion is that neither of them are really going to be too effective in long-term outcomes. Kind of as a general rule, ice for a reactive tendinopathy, early tendon disrepair issue, being that you're trying to decrease inflammation, or decrease cell proliferation and fluid accumulation in the tendon. And so if you can get fluid to kind of get out of the area, which would be by using ice, so you're kind of you're constricting your blood vessels in the area, can be a little bit beneficial. I don't think it's as effective as what we really think it is, or what we once thought it was. For a late tendon disrepair, degenerative tendinopathy, heat would be the logical choice, just being that you're trying to increase blood flow in the area to stimulate growth. With that being said, heat or ice, I don't think it makes too much of a difference in terms of overall outcome. you're looking at more kind of pain relief. So whichever one kind of gives you the most pain relief, I think is probably your best choice. That is pretty much it on kind of like an intro on tendinopathies here. Hopefully you guys found this beneficial if you're dealing with a tendinopathy. It's come a long way in the last couple years in terms of how we treat it, how do we approach it, and all that kind of stuff. So hopefully this kind of gives you a good little background on it and helps you out with your tendinopathy.